Anger and shock outside a Salt hospital in Amman. A 1-hour cut to vital oxygen supplies has been blamed on the deaths of patients. It affected intensive care, maternity and coronavirus wards. A backup supply arrived too late for some.
My father and mother are at the coronavirus isolation zone inside the hospital. By coincidence, I was inside the hospital when suddenly the oxygen was cut. We asked staff who said they had run out of oxygen and that they are waiting for a truck for more supplies. We received assistance from the civil defense. Some of them were inside the hospital and they provided oxygen cylinders and then started to resuscitate patients, among them my parents.
Security forces have been called in, preventing anyone unauthorized from entering the hospital. These people have no choice but to wait for news.
There was an oxygen outage and there were no measures to prevent this. It is known that in all Jordanian hospitals there are motors available just in case electricity goes down. Even before the coronavirus outbreak, when there are surgeries at hospitals, there's always spare equipment. But here, there was an oxygen outage.
I gave my father CPR 3 times and twice to my mother. I called the director of the hospital at 10:30. The isolation ward has only 1 doctor and 2 nurses to serve 50 to 60 patients. This is unfair.
The fallout was swift. Health Minister Nathir Obeidat resigned. And King Abdullah arrived to a mixed reception from crowds at the hospital. He immediately ordered the hospital's director to also resign. Parliament has set up a special committee to investigate, and Prime Minister Bisher al-Khasawneh says there is no justification for what happened.
The government and only the government takes full responsibility for this very painful incident. We will not resort to excuses or justifications about what happened. What happened was horrific, so it is impossible to deny or to escape responsibility. The death of 1 Jordanian due to these failings is unacceptable.
But there are people here who say the hospital was understaffed and ill-prepared. And many are asking why a failure like this went unnoticed until it was too late. Burdon-Manley, Al Jazeera.